All right, today we're diving into one of the most common heart conditions a person can be born with, the atrial septal defect, or ASD for short. Now, this is something that can actually fly under the radar for years. So, we're going to break down exactly what it is, and more importantly, why the way we fix it today is just so incredibly effective. So, have you ever heard that phrase, a hole in the heart? I mean, it sounds pretty dramatic, doesn't it? But a lot of the time, it's actually referring to a very specific, and you know what, a very manageable condition. So let's get into what that really means. Okay, so what is an atrial septal defect? Well, in the simplest terms, it's a hole in the wall. That wall is called the septum that sits between the heart's two upper chambers, the atria. And here's the surprising part. This is actually the most common congenital heart defect that's found in adults. So if this is something you or a loved one is dealing with, it's really important to know you are definitely not alone in this. Okay, so we've established it's a hole between the heart's chambers. But so what? Why is that a big deal? Well, let's get into the stakes here, because understanding why closing an ASD is so important is, well, it's crucial for your long-term health. The main problem here comes down to something called right heart dilatation. See, your heart is designed so the pressure on the left side is higher. Because of that hole, some of that oxygen-rich blood that's supposed to go out to the body, it leaks from the left side back over to the right. This creates extra blood flow, a bigger workload, and it forces the right side of the heart to pump way harder than it's supposed to. And you can imagine, over time, that extra strain causes those right side chambers to stretch out and get bigger. And if that enlargement, that stretching, isn't dealt with, well, that's when you start running into some serious long-term risks. We're talking things like arrhythmias, that's an irregular heartbeat, or even right heart failure, where that side of the heart just gets too tired to pump effectively. It can even lead to high blood pressure in the lungs. These are the exact problems that treating an ASD is designed to stop in their tracks. Okay, I know that all sounds pretty serious, but here's the pivot, and it's a really good one. The news here is just overwhelmingly positive. Modern medicine has a fantastic, safe, and super effective solution. So let's talk about that modern fix. For the vast majority of ASDs, the go-to solution is this minimally invasive procedure called percutaneous closure. It's actually pretty amazing. A doctor guides this tiny little device, you can think of it like a little high-tech patch, through a blood vessel, usually in your leg, and travels all the way up to the heart. Once it's in the right spot, they deploy it and it opens up to cover the hole, sealing it off. And the best part? Over the next few months, your own heart tissue grows right over the device, making it a truly permanent seal. Now, what if that little patch device isn't the right fit for some reason? Well, for that small number of cases, it's really good to know that the more traditional surgical closure is still a fantastic, safe, and super effective backup plan. So the big question is always, what's the risk? Well, get this. The risk of any major complication, whether we're talking about the minimally invasive procedure or the surgical option, is less than 1%. I mean, that is an incredibly low number. And this quote from the source material just perfectly sums it all up. The bottom line is, the benefits you get from closing the ASD, both in how you feel day to day and for your long-term future, are just, they're huge. And they totally outweigh any of that tiny risk involved. All right, so we've covered the what and the how. Now it's time to talk about the when. And, just like with so many things in medicine, timing here, well, timing is everything. There's been a really massive and important shift in how doctors think about this. The old way of doing things was reactive. Basically, let's wait and see. You'd wait for a patient to start showing clear symptoms before doing anything. But that's a thing of the past. Today, the standard of care is all about being proactive. The moment an ASD is diagnosed and we see that right side of the heart starting to get bigger, the recommendation is to close it. The whole goal is to head off those long-term problems before they even get started. So, what does this proactive mindset look like in real life, at different ages? Well, if you're a child or a young adult, say under 25, closing that defect gives you the absolute best possible outcome. But what if it's found later in life? No problem. Closure is still highly, highly recommended for your long-term health. And what about pregnancy? If an ASD is found then, it's usually considered pretty low risk, and doctors will just plan to do the closure procedure a few months after the baby is born. Now, for older patients, there are a few extra things to think about, but the key here is that every single one has a clear plan. For example, the heart might not shrink all the way back to its original size, but the closure still gives you huge benefits. If you already have some of those irregular heartbeats, your doctor might want to do a procedure called a catheter ablation first to get the rhythm back on track. And to make sure no clots form while that little device is healing, you'll likely be on some blood thinners for about 6 to 12 months. See, they're all just well-managed, solvable issues. And that brings us to maybe the biggest and definitely the most important question of all. Once the procedure's done, what's next? What does the future actually hold? Let's talk about life after the treatment. And honestly, this might be the most powerful piece of information we've talked about. For anyone who gets their ASD closed before they turn 25, the evidence is clear. They can expect a completely, totally, 100% normal lifespan. And in a lot of these cases, they're eventually discharged from needing a specialist at all. It's not a patch, it's not a temporary solution. It's a real permanent fix. So we'll leave you with a final thought to take with you. Now that you know that a pretty common condition like an ASD has such a safe, effective, and proactive solution, one that's all about preventing problems down the road, what does that empower you to ask your own doctor about your heart health? Thanks so much for joining us for this explainer.